On behalf of the City of Laredo Health Department, I would like to welcome our media partners, community stakeholders, city leadership, and members of the public who have joined us today. We sincerely thank you all for being here. Before we begin, I would like to briefly outline a few important ground rules to ensure today's briefing runs smoothly and respectfully. First, we will be providing a structured presentation of the ETO assessment findings. In order to maintain clarity, accuracy, and consistency in messaging, we ask that all questions be held until after the formal press conference is concluded. All media questions will be addressed immediately following the conclusion of the press conference in a one-on-one interview format. Thank you all, and we appreciate you all being here. Before we continue, I would like to take a moment and distinguish a few guests that are joining us today, starting off with the Mayor of the City of Laredo, the Honorable Dr. Victor Trevino, and his lovely wife, Ms. Rosa Marquez de Trevino. Council Member for District 3, the Honorable Melissa Cigarroa. Assistant City Manager, Mr. Steve Landin. And Laredo Public Health Department Director, Dr. Richard Chamberlain. So to get this press conference going, I would like to call up the Mayor of the City of Laredo, Dr. Victor Trevino, to share a few words.
All right, good morning, everyone. Thank you for being here today. And thank you to the Health Department, Dr. Chamberlain, and our environmental partners, members of the community who are here with us to support this important issue. Today, we're speaking about an issue that affects both the health of our families and the economic vitality of our city. Air emissions are important, and specifically the presence of ethylene oxide in the air. Let me be clear, nothing is more important than protecting our health of our residents, our children, our seniors, and our workers. And as you may be aware, ethylene oxide is a chemical used in the industrial and medical sterilization process, but it's also recognized by federal health agencies as a substance that can pose risk to human health at certain levels, including cancer risk and at long-term exposure. We also recognize that companies that operate in the community play a role in supplying important products used in healthcare and other sectors. So we're taking a balanced approach, one that says that we will work with the industry, with state and federal regulations, and we will work with health experts to reduce emissions while also supporting responsible business that care about doing the right thing. We will also continue to monitor data that support expanding testing for ethylene oxide and other pollutants. Our city health department will provide regular updates to the public, and we will ensure that residents know what the science says about possible risk and protective steps. We believe that environmental responsibility and economic health are not two opposing forces. They are mutually reinforcing. Cities that lead on environmental health often attract other businesses and invest because they demonstrate predictability and responsible regulation. We will continue to engage the public and expert agencies that have authorities in this area, including state air quality regulators and the U.S. Environmental Protection Agency, standards on hazardous air pollutions. Those standards are designated to reduce emissions on ethylene oxide significantly and lower community health risk. And we want to see them implemented with both safety and fairness in mind. We will provide clean air, science-based information for residents, not fear or guesswork. We will publish air monitoring results, explain what they mean, and act on them. We will hold community meetings so people can ask questions and participate in conversation about their health and their environment. And in closing, I do want to emphasize what this effort is really all about. A safe and thriving city of Laredo, where families can breathe clean air and workers can earn a good living. Protecting public health is our highest obligation. This is the reason why I ran for mayor, and achieving that partnership with responsible business is the best path forward. Thank you very much.
Thank you, Mayor. At this time, I would like to invite Dr. Richard Chamberlain as he will go over the executive summary of the assessment.
Good morning, everyone. First and foremost, I did want to start off by thanking the community, our community advocates, our community-based organizations. Thank you to Rio Grande International Study Center. Thank you to Ms. Olivia for being here with us. We appreciate you all's voices and for helping us get to this moment. Also, most importantly, thank you to the members of the council and the mayor for their support. Bureaucracy takes a little while to get things done, but we're getting those things done for the members of the community. With that, we do have the report to present today. We're sharing the results from a short pilot study that measured ethylene oxide in the outdoor air in Northwest Industrial Laredo. ETO, ethylene oxide, is a chemical used in some industrial processes, including sterilizing, and health agencies pay attention to it because breathing it over a long period of time may cause increased cancer risk. What we did. From October 16th to November 10th of 2025, we collected air samples at 8 outdoor locations near the area of concern as showcased within the assessment, including areas where people work and travel every day. We collected 6 24-hour samples at each location about every 5 days. Each sample represents an average for a full day. The air quality monitors around the city measure PM levels and not ETO. We wanted to make sure that we made that distinction. This was an informational public health study. It was not a compliance test, and it was not continuous monitoring. What we found. The results varied by location and by day. Some locations had higher readings than others, and the higher readings most often showed up at sites closest to the study area. We also calculated something called delta C, which is simply the difference between the highest and the lowest site readings on the same day. This helps us see the spread of the results across the 8 locations during each sampling day. What the results mean and what they do not mean. I want to be very clear. These results are a snapshot because we only sampled 6 days over about a month's time. This study cannot tell us the long-term average for its area and cannot itself determine the long-term risk. Risk for ethylene oxide is mainly discussed in terms of long-term exposure over many years and not a few days of sampling. What these results can do is tell us that we have enough information to justify additional monitoring and better long-term surveillance so we can understand whether these higher readings are happening often, only under certain wind conditions, or during certain times of the year. Data quality and transparency. We included standard quality checks during sampling and lab testing. We are sharing results with technical partners, including the Texas Commission on Environmental Quality and Environmental Protection Agency, to get feedback on the best way to interpret the data and improve future monitoring. What happens next? Our next step is to plan an additional monitoring effort. We will collect more samples, include a true background location. That type of monitoring gives a clear picture of the typical conditions. We understand that the chemical monitoring results can raise concerns. Our goal today is to be transparent and to keep the community informed. We are committed to continued updates and to working with our state and federal partners, and most importantly, the members of our community. I'm going to say this in Spanish now as well. Please smile as often as you'd like. Buenos días. Hoy compartimos los resultados de un estudio piloto corto que midió oxígeno de etileno, también llamado ETO, en el aire exterior en el noreste industrial de Laredo. El ETO es una sustancia química que se usa en algunos procesos industriales, incluyendo la esterilización y las agencias de salud les dan seguimiento porque respirar ETO por mucho tiempo puede aumentar el riesgo de cáncer. Lo que hicimos, del 16 de octubre al 10 de noviembre del 2025, recolectamos muestras de aire en 8 ubicaciones exteriores cerca del área de interés, tal como se muestra en la evaluación, incluyendo zonas donde la gente trabaja y transita todos los días. Recolectamos 6 muestras de 24 horas en cada ubicación, aproximadamente cada 5 días. Cada muestra representa un promedio de un día completo. Los monitores de calidad del aire que hay en Laredo miden niveles de PM, partículas, y no ETO. Este fue un estudio informativo de salud pública. No fue una prueba de cumplimiento regulatorio y no fue un monitoreo continuo. Lo que encontramos. Los resultados variaron según la ubicación y el día. Algunas ubicaciones tuvieron lecturas más altas que otras, y las lecturas más altas se presentaron con mayor frecuencia en los sitios más cercanos del área del estudio. También calculamos algo llamado delta C. Simplemente es la diferencia entre la lectura más alta y la más baja entre los sitios en un mismo día. Esto nos ayuda a ver qué tan dispersos estuvieron los resultados entre nuestras 8 ubicaciones durante cada día del muestreo. ¿Qué significan los resultados y qué no significan? Quiero ser muy claro con esto. Esos resultados son fotografías del momento. Como solo muestraremos 6 días durante aproximadamente un mes, este estudio no puede decirnos cuál es el promedio de largo plazo del área, y por eso solo no podemos determinar el riesgo a largo plazo. El riesgo de ETO normalmente se analiza en términos de exposición a largo plazo durante muchos años y no con unos cuantos días de muestreo. Lo que sí pueden hacer estos resultados es mostrarnos que tenemos información suficiente para justificar monitoreo adicional y una vigilancia más largo plazo, para entender si estas más lecturas más altas ocurren con frecuencia, solo bajo ciertas condiciones de viento o solo en ciertas épocas del año. Calidad de datos y transparencia. Incluimos verificaciones estándar de calidad durante el muestreo y las pruebas de laboratorio, y estamos compartiendo los resultados con socios técnicos, incluyendo a la Comisión de Calidad Ambiental de Texas, TCEQ, y la Agencia de Protección Ambiental, EPA, para recibir retroalimentación sobre la mejor manera de interpretar los datos y mejorar el monitoreo futuro. ¿Qué sigue? Nuestro siguiente paso es planear un esfuerzo adicional de monitoreo. Recolectamos más muestras, incluyendo un sitio que funcione como un punto de fondo real. Este tipo de monitoreo da una imagen más clara de las condiciones típicas. Entendemos que los resultados de monitoreo de sustancias químicas pueden causar preocupación. Nuestro objetivo hoy es ser transparentes y mantener informada a la comunidad. Estamos comprometidos a seguir dando actualizaciones y a trabajar de la mano con nuestros socios estatales, federales y con nuestra comunidad. Muchas gracias.
Thank you, Dr. Chamberlain. This will conclude the press conference. We are going to showcase a brief slideshow with some frequently asked questions. So I would like to call on Councilmember Melissa Sierra for a few remarks.
Thank you. Good morning, and thank you so much for being here with us as we listen to this incredibly important information from our Laredo Public Health Department. And I do thank Dr. Chamberlain and his team for doing such an excellent effort to find this information. This was a charge by City Council in conjunction, I would say, or with advice from the Clean Air Laredo Coalition that was sponsored by the Rio Grande International Studies Center. The concern we have, of course, is what you've heard, that Midwest operates in our city, and they are the largest sterilizer plant in the country, using over 1 million pounds of ethylene oxide during the year. What we understand from the company is they do follow EPA regulations, and they have worked to maintain clean air controls at their plant. But as good stewards of public health, as the mayor explained, we have to check that. We have to make sure that what their processes are do protect public health. Of concern, however, is that the EPA has not maintained regulations for off-gassing of products. And we know since this is the largest sterilizer plant, they produce the most sterilized products of any company of a sterilization plant in the country. So off-gassing of these products is an incredibly important item to be measuring. That is because there are no regulations, it is less clear what those processes are. And as a city, you can be assured that we will continue to press for that information because that is also a vital aspect of maintaining public health here in the city of Laredo. So thank you again to the Laredo Public Health Department. We look for cooperation from Midwest as we explore these ideas because we do believe we can work in partnership to find out what those levels are. And also we will be working with our federal partners to see what the next steps they can do to make sure that off-gassing is equally as regulated as the products that are produced from these plants. Thank you so much.
Thank you. And also before we conclude, I would like to thank our air quality program team that helped put this together and work with ERCOM and all the technical work behind it. So a big thank you to Mr. Gilbert Garcia, our environmental public health manager, Ms. Young Hung Lu, our air quality specialist, and Ms. Amelia Solis, our epidemiology administrator. Thank you. So with that, we will conclude. There will be a slideshow with some FAQs, the link to the actual document, and like mentioned, our interviews will be on a one-on-one basis, and thank you all for joining us.